patient has previously undergone evisceration and presented with fornicel shortening and difficulty retaining a prosthesis. Due to childhood Stevens-Johnson syndrome, a keratoprosthesis was planned in the fellow eye and therefore buccal mucosa was limited. Therefore, an off-the-shelf dried amniotic membrane was considered as a substitute. The inferior eyelid is placed on traction with 4-row silk sutures through the grey line, and the inferior bands of conjunctival scarring are lysed using a number 11 blade. 7-row vicryl is used as a pre-placed suture to secure the graft. These are placed at the nadir of the incision to give maximum fornicel depth. The unique feature of dried amniotic membrane, as is used in this case, is that it does not undergo freezing prior to drying and has a shelf life of approximately 12 months. The amniotic membrane is then moistened using normal saline intraoperatively, though cutting prior to moistening may also be an option, as the graft does lose rigidity once this is done. The graft is then cut to size to allow it to be fitted into the fornix. The graft is then bedded down so that it's not under tension. The membrane is then sutured into place using the already present 7-row vicryl sutures. A cosmetic conformer is placed at the end of surgery and left for 6 weeks to help maintain fornicel depth. The exact function of amniotic membrane in the context of fornix reconstruction still remains unclear. It is likely that it promotes epithelialisation, possibly by virtue of its thick basement membrane, though it is not known whether this acts as a base layer or a patch, or whether it entirely dissolves, and if so, how quickly, and whether there is persistence of amniotic membrane under the new epithelium. At 6 months following surgery, the patient was able to retain the prosthesis with evidence of a deepened fornix. It is uncertain whether simple lysing of the conjunctival scar tissue and placement of a conformer would have given similar results, though placement of a dried amniotic membrane allograft does appear to be positive in this case.